Welcome everyone to today's webinar, Advancing Population Health Through Intelligent Care Gap Closure. I'm Katie Adams with Becker's Hospital Review. We will begin today's session with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We look forward to hearing your questions. Today's webinar is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, I am pleased to introduce our speakers. Dave Henriksen serves as Vice President in Clinical Operations for Castel, where he leads the company's efforts to operationalize value-based clinical care models. Dave brings many years of experience in clinical operations at Intermountain Healthcare to this role, as well as targeted leadership in advancing Intermountain's understanding of value-based care. He has been integral to the early successes of Intermountain's value-based care model called Reimagine Primary Care, having led the development and implementation in clinics across the health system. Prior to Intermountain, Dave managed 6 outpatient surgical clinics at Kaiser Permanente in Portland, Oregon. Dave received a Master's of Healthcare Administration from the University of Minnesota. Chris Moog serves as Clinical Solutions Lead at Notable. His primary area of focus at Notable is developing applications of Notable's automation software in the clinical realm, particularly in population health and value-based care. Prior to Notable, Chris worked in clinical product development across the digital health space and practiced in emergency medicine as a physician assistant. He has also held hospital administrative roles as the APP director and PA education lead. Chris still practices clinically on a part-time basis. It is now my pleasure to turn the floor over to Chris Moog to begin today's presentation.
Chris, I believe you may be on mute.
Oh, I'm so sorry. It wouldn't be a webinar without one technical glitch. But thank you to everyone for joining us today. This webinar is our first in Beyond the Portal, the digital front door, where we're exploring why an effective digital front door strategy must go beyond the patient portal to engage patients and accelerate health system growth. We're kicking off the series with population health because expanding the digital front door is essential to closing gaps in care. Like you heard, I'm Chris Moog. I'm a physician assistant and the clinical solutions lead at Notable. My primary focus at Notable has been developing our population health solution and helping our partners in healthcare to develop their strategy on population health and value-based care and take advantage of the enormous opportunity in the space. You also heard I'm joined by Dave Henriksen from Castel. Dave's been an incredible partner at Notable. Dave, it's great to have you here with us today.
Thank you.
So we'll kick off today's presentation with a discussion of the market forces shaping population health. Then Dave is going to provide a closer look at how his team at Castel is using automation to close care gaps faster, with more accuracy and without disrupting existing workflows. Then we'll provide some best practices that we've seen across our partners and end with an opportunity to answer some questions. Let's get started with the level set on population health in the US and the themes we're seeing that make it a priority. The state of health and the cost of delivering healthcare services in the US has pressured our health system to really reevaluate how we're reimbursing and how we measure the quality of care that we're delivering to our patients. We don't need to spend a whole lot of time reviewing the enormous and growing cost burdens in our health system. But this, along with the disproportionate health outcomes across the population, has driven healthcare to this realization that fee-for-service is not the future, and value-based care is no longer a model that can be delayed. The accelerated adoption of value-based care models by payers and providers alike has created a better balance and alignment between the two. This makes value-based care an easier pill to swallow, knowing that your counterparts across the aisle benefit from the same health outcomes and cost reduction metrics. And value-based care sounds wonderful, but ultimately it's a little idealistic if we can't put it into practice in a way that's economical. Technology is the key to adopting value-based care models in a way that improves health outcomes for patients, but also drives growth and increases operational efficiency across the healthcare continuum. The tipping point of value-based care was actually back in 2006 when CMS made the decision to expand Medicare Advantage and introduce so many other risk-based payment models. Today, Medicare Advantage is by far the largest risk model available, and it's growing rapidly. CMS is predicting that more than half of Medicare beneficiaries will be in Medicare Advantage plans by 2030. And this enormous program comes with really enormous financial opportunities. Medicare Advantage plans have the opportunity to get a 5% bonus payment if they reach a 4-star rating or higher through the quality metrics defined by CMS. And for context on what that effort is worth, in 2021, CMS gave $11.6 billion in bonuses for Medicare Advantage star ratings. Beyond Medicare Advantage, CMS has multiple other programs that offer a way to incorporate risk into your business model. And if we look at all these value-based care programs together, they show that over 80% of patients in the US are enrolled in some risk model. And this has led to 1/3 of reimbursement revenue coming from value-based care. And with the growth of Medicare Advantage and other federal policy pushes, this is going to continue to increase every year. One of the biggest benefits of value-based care is that payers and providers are now more aligned than ever on how healthcare should be delivered to patients, making these competing goals of lowering costs and improving quality of care easier to attain. This is demonstrated by the commitment of payers and providers to succeed on the mutually beneficial metrics for value-based care. Patient experience, for example, is now directly tied to the financial success in value-based care. Payers and providers are increasingly being assessed and rewarded on the experience they deliver to patients. In Medicare Advantage plan, there is now a greater emphasis on experience-related measures. So failing to perform on patient experience means that your star rating is going to suffer and in turn make it much more difficult to earn that star rating bonus. Health outcomes similarly dictate payment. Closing care gaps and meeting HEDIS measures have always been important from a clinical perspective. But now these are rigorously measured and tracked, and they have a major impact on the success of a value-based contract. In 2022, care gaps are going to account for about 26% of the star rating. And beyond just care gaps, the idea of whole person care has been estimated to be worth $185 billion in cost savings. So providing patients with education, easy access and engagement, and hitting the quality metrics associated with outcomes have enormous financial benefits. But delivering that type of care requires the right tools. This is where technology comes in. 10 years ago, patient engagement had to be either through the mail or by phone, or it had to be owned and initiated by the patient themselves. Today, though, healthcare organizations are able to use technology to meet patients where they are and provide a delightful experience in doing so. Furthermore, the number of FTEs required to perform the manual workflows to outreach and engage, schedule visits, and document care on every patient is impossible to hire and retain. On top of that, this type of work is repetitive, and it really fails to empower these care coordinators and nurses to work at the top of their license and frankly, to do the type of work that brought them to healthcare in the first place. But with automation, all these manual workflows can be replaced with software that reaches every patient with consistent engagement and never gets tired of the repetition. Across the industry, there are endless opportunities for technology to be applied to population health, and the impact from the deployment of these solutions has minimized the challenges that make many health systems hesitate when evaluating value-based contracts. These challenges, they start with employing the right people and enough of them to deliver the quality of care needed for a successful population health strategy. Especially in this market where labor shortages are extensive, the importance of using automation to improve staffing ratios and retention can't be overstated. Ensuring that health systems have high-fidelity data is also core to making a population health initiative successful. But because healthcare organizations are often navigating this patchwork of disparate EHRs and other healthcare applications, it's incredibly difficult to get the right data into a single place and into discrete fields that can be accurately tracked and acted upon. This is especially important because these VBC contracts require reporting on quality metrics, and the reimbursement is often subject to bonus payments or shared savings that aren't delivered until year end. So if a healthcare organization isn't paying close attention to all these metrics throughout the year and ensuring the data can be relied upon, the bottom line is going to suffer. And finally, empowering patients to engage and invest in their own health requires healthcare organizations to deliver the right care to the right patients at the right time. And this means having not just a system of record, the EHR, but also a system of action to surface the right data at the right time and initiate engagement in a patient-centered, personalized, and dynamic manner that will lead to measurable outcomes for both the health of your patients and also the economics of your organization. Deploying any technology in healthcare is incredibly difficult, and intelligent automation is a relatively new approach to solving problems in our health system. Our partnership with Castel is really an amazing example of how intelligent automation can be deployed at scale quickly and with measurable results to operationalize population health initiatives. Dave, I'll hand it over to you to tell the Castel story.
All right, thank you, Chris. I think you did a great job articulating the situation that we're all in, and I think we're all at various stages in our value-based care journey, but those pressures are upon all of us. So a little overview of Castel. Some of you may be wondering a little bit of what that is. We are a wholly owned subsidiary of Intermountain Healthcare, and we really exist to do two things. One, to help people enter into more risk-based arrangements or value arrangements, and then two, help them perform in those risk-based arrangements. And we certainly have sought to embrace some technology to help us be able to do that. In all, we have about 1 million lives that we're at risk for with Castel and Intermountain Healthcare. So the ability to be able to scale and meet the needs of our population is certainly one that is at the forefront of our mind. One of those in particular is care gap closure. And I think Chris did a good job articulating a little bit as to why that is important. Certainly, it's the right thing to do to take care of people and help them accomplish the things they need to in order to maintain good health. But it has been very clear that performing in that space is important from a financial perspective as well. So one of the things our teams do in order to help us perform in that way is called chart scrubbing. And we do pre-visit planning where a care coordinator about 3 days in advance will take a look at a provider schedule and go through and see who is coming through that day and go and identify what care gaps really need to be closed and which gaps may already be closed but simply have data in the wrong fields or in non-coded fields and are not satisfying that care gap closure. In some cases, also have information coming from claims and try and sift all that together so that when the provider walks into that visit with a patient, they know what they should be talking to them about. However, in order to do that work, as you can imagine, it's fairly manual. We had caregivers who were doing, 100 charts per day. It was taking about half of their time of an 8-hour day. And ultimately, it's not maybe the most fun work to do. You are meeting a need, and there are really cool things that we find and problems that they solve, but it's pretty tedious and manual work. In addition to that, we began to land some additional risk contracts that were increasing the number of lives that we had to impact exponentially. And so we said, how are we going to replicate this process? We really can't keep doing the same thing that we're doing and hire enough people, especially with kind of the shortage of FTEs that you can hire anyway. So we said, we've got to figure something out. I had spent some time doing a little shadowing of a care coordinator and saw that we could potentially automate some of their work, and also knew that our broader Intermountain Healthcare team had been partnering with Notable to automate certain intake forms and used these things called notable bots to be able to do some of the work that a human could do. And so we decided to go forward and figure out if we could automate the work of pre-visit planning to reduce the need for so many FTEs and still get the work done in an accurate way. Ultimately, we kicked this off very quickly. We decided to engage with Notable early in the second quarter, and by the end of the third quarter, we had actually scrubbed about 400,000 charts, supported 446 providers, and had done that across 8 major care gaps for our live, automations, the ones where we probably spend the most time doing that work, which includes colonoscopies, mammograms, A1Cs, and things of that nature. Ultimately, what we found through the test and turning this on is that we took what used to take 4 hours down to 1 hour. This resulted in an equivalent of about 41 FTEs in that time and about $2.5 million worth of cost just from our people doing the work. It doesn't factor in the fact that, we closed a lot of care gaps, helped a lot of people, and ultimately improved our quality performance in a time where it was challenging due to COVID. We certainly didn't drop it to zero. There's still work for our care coordinators to do in verifying and validating some of the work that's been done by the bot and make sure that it gets surfaced to the provider in their workflow so that they're not having to go search for the information and it gets populated as they are able to walk into that exam room and talk to their patient. The other thing we're introducing and just kicking off here with Notable is related to our work with care plans, with our care managers. Many of you may be familiar with this as you have care managers doing ambulatory care management. There are standards that need to be met and information that needs to be gathered in order to be able to complete those care plans. Those can certainly be done either in person or over the phone. And the reality is they take a long time in order to be able to gather that information from our patients. And in many cases, it's repetitive or information they have already provided to our system in other settings. So what we are partnering with Notable on is an ability to, we make an appointment with the patient to meet with our care manager, and 2 days in advance, they get a text message like the one you see over there on the left-hand side of the page. With that, they then authenticate who they are and make sure that's the right person. They then jump in and they start to begin to fill out some of the assessments that we need in order to be able to develop a comprehensive care plan for those individuals. They'll also answer some questions from common standards forms, things that we need in order to be able to understand what we can do best for that patient. And you can see what some of those look like there on the screen. One of the things that is challenging as we do care management is meeting NCQA accreditation criteria. And one of the things we have enjoyed is the ability to be able to take kind of our standard ambulatory care management care plan, and for the assessment component, really be able to have that pre-populated and loaded based on what the patient filled out in those forms that I just previously showed you, which they can do on their computer or do on their phone. What they input actually goes in and pre-populates the nurse's note, saving them a ton of time in documentation and also a ton of time in talking through all of those things with the patient. We certainly still take time to review it and verify things that may look a little off and discuss those with the patient, but it creates a situation where the patient feels like their caregiver knows what's going on and they filled out that information for a reason. And we had time to digest it well in advance of being able to do that. We have a little video here that we'll show you that walks through some of the experiences that we've been having, specifically with the care coordinator work that we've been doing on pre-visit planning. And I'll try and advance that now. Hopefully this works.
My name is Ashley Trost. I am a project coordinator for Castel. It's an Intermountain healthcare company that was created to help accelerate the transition from volume to value-based care. Before Notable, it was really tedious and it's time consuming. When you're so busy working through the monotonous paperwork and documentation, you really don't get to work with people. And now with Notable, we're able to do that and really focus on why we all went into healthcare, and it was to help people. The chart review process, it can be very tedious. It's like looking for a needle in a haystack. We refer to our care traffic control teams as little detectives because they're so good at finding these little breadcrumbs that'll lead to these really big rewards. And with Notable now, we're able to streamline that process and make it more efficient. I've definitely seen a boost in morale with our care coordinators. We have created 34 FTE capacity. They've taken our chart review process from 4 hours a day per care coordinator down to 1 hour or less. And that's really impactful. Imagine if you get 3 hours back in your day, the things that you can do and the people that you can really impact is impressive. All of the information is surfaced on one form in one central location every single time in the same way. It's one click instead of multiple clicks. It brings a more complete picture of a patient's healthcare journey. We're able to provide more personalized care, affordable care. We're not spending as much time doing the detective work. We're spending time caring for patients. And by doing so, we're getting people in for really important preventative measures that could potentially save their life. One of our care coordinators noticed that Notable had surfaced that this patient needed a colonoscopy within 3 to 5 years, and the default is actually 10 years. This patient went in and they had 2 polyps. Without Notable, this patient could have had a worse outcome. For me, that's really important that we're making a difference and we're taking care of patients and that we're really improving patient outcomes.
All right, a big thank you to Ashley for taking the time to do that and walk through some of those examples. Hopefully that gives you a little better idea of some of the ways we're using intelligent automation to be able to automate some of the functions of our workforce and be able to move into the new workforce of population health as we all continue to take more financial risk and improve the health of the people that we take care of. And I'll turn the time back over to Chris, who's going to walk through some other practices from Notable partners.
Awesome. Thank you, Dave. So we'll jump right in and go through some of the best practices we've developed with a few of our different partners. The first of these is what we call the test and learn approach. This is similar to the lean or agile methodologies that many of you may be familiar with. But the first step in this approach is identifying the largest ROI opportunity. For some organizations, this might be care gap outreach. For others, like Castel, it might be chart scrubbing or payer gap attestation. But a common roadblock I've seen for a lot of organizations is just getting overwhelmed with all the different problems that need to be solved within any particular area in population health. So to be successful in this first step, we at Notable recommend that you start with a really focused approach that solves a single problem, but one that still has a large ROI. And then once that problem of focus has been defined, deploying a solution rapidly is key to success. And in this step, there's a couple common traps I want to touch on here. The first is delayed integration, which sadly has become the norm when it comes to deploying new solutions in healthcare. Delayed integration slows the ability of a solution to achieve end-to-end automation, and it makes it difficult to capture data and measure the impact. This can be prevented by finding a partner that has the capability to integrate seamlessly and quickly into your existing workflows and arguably most importantly, do so without requiring a huge IT investment from your internal team. The second trap I want to highlight is over-indexing on desired features as opposed to desired outcomes. Focusing too much time and effort on checking a box that you have a specific feature without ensuring that these features will actually deliver outcomes will slow deployments and in many cases has a negative effect on outcomes. You can avoid this particular trap by choosing a partner that is equally focused on outcomes, not distracted by features for the sake of features, and one that will work towards ultimately eliminating manual work altogether instead of simply just shifting work downstream. Deploying quickly also has an intrinsic value through achieving ROI quickly, or if that ROI isn't achieved right away, you learn quickly what can be improved to accelerate that path to value. And then after deployment, using data to continuously assess performance allows teams to iterate and drive improvements. And a common misstep we see here is failing to define your ROI metrics and baselines prior to deployment. And if you have this alignment, teams can quickly learn where exactly they need to focus their iteration efforts to elevate the ROI. This is the test and learn approach. Define your problem, define your metrics and baselines, deploy quickly with integration, measure, and then iterate towards value. Simplifying engagement for patients is another best practice that has been shown to have a truly significant impact on outcomes. Relying on portals for patient engagement creates this risk that the digital front door is only going to be open to those who are already digitally engaged with the health system, and this will leave out a large portion of the patient population. Mobile apps also face a similar challenge. Patients who are most likely to digitally engage are also most likely to experience what we call app fatigue, the frustration of having to download another app and having to remember another login password. And oftentimes this is a large enough barrier to block engagement. And even the fraction of patients who've actually downloaded the app or signed up for the portal, they may still not necessarily engage through these tools. So we recommend complementing portals and apps with the communication channels that patients are already using. Text and email have been particularly successful here. Ultimately, simplifying engagement and lowering barriers to care starts with meeting patients where they are and using their preferred communication channels. DataCare is a perfect example of how simplifying engagement can be incredibly impactful. DataCare is a 7-hospital health system and a leading population health organization in Wisconsin. They partner with Notable to advance their population health initiatives and started with care gap outreach. With care gap outreach, they were able to triple their patient engagement and close more than 900 care gaps in just the first 3 months. And throughout this process, they provided this consistent, highly personalized, and really simplified patient experience. Expanding the capacity of your workforce is our third and final best practice that we'll cover. Most of you have probably found that a lot of digital tools in pop health and elsewhere within healthcare have often introduced more administrative overhead to the manual workflows that they aim to replace. In today's capacity crisis, this is unsustainable. Technology should expand, not shrink the capacity of your people. And it's only through the automation of these workflows that staff are going to be freed to deliver the highest quality care to every single patient. As a provider, I've seen how powerful end-to-end automation can be in empowering care teams to focus on patient care instead of being bogged down with paperwork and data transfer. And in my experience, this is one of the most challenging parts of being a provider, not being able to spend the majority of your time actually caring for patients, which is really why most of us went into healthcare in the first place. This was especially evident at Austin Regional Clinic. They're a multi-specialty clinic serving about 500,000 patients across 12 different cities. With Austin Regional Clinic, Notable deployed automation to capture clinical information from patients and then use that to pre-populate a large portion of the provider's note prior to the patient's visit. This included sections like the HPI and ROS, which providers traditionally have manually entered, but collected the information directly from the patient. As a result of this automation, we were able to decrease documentation time by 45%. And on top of this, providers reported that they were able to see more patients throughout the day, focus more on their patients during those visits, and then still leave the office earlier to spend time with family. Intermountain is another great example of intelligent automation removing administrative burden from care teams. Intermountain is a leading health system with 24 hospitals and 215 clinics, and they partnered with Notable to modernize their patient registration and intake experience, which prior to Notable was highly manual and really time-consuming for staff. To automate check-in and registration at Intermountain, Notable deployed digital assistants or bots to collect or confirm information directly with the patient and then place that information into the appropriate EHR fields, more or less mimicking the original manual workflow, but in an automated process. The outcome here was an average of 30 minutes per day in time savings per medical assistant, and it really freed up these MAs to focus instead on direct patient care. So this slide is pretty busy, and I'll talk through each section here, but the ultimate idea is that Notable's platform empowers providers to automate high-value healthcare workflows throughout the healthcare continuum, and we do so by using this unique approach and combination of different capabilities. We'll start at the top of the slide. Each of these solutions represent areas where Notable has automated workflows that have been disproportionately manual in the past, or maybe there's point solutions, but they've failed to achieve end-to-end automation, which has resulted in more work queues or applications to manage and really ended up creating additional manual work. But if we move across the top section, in activation, we're proactively bringing patients in for needed care, including care gap outreach and chart scrubbing. In referrals, we're helping patients transition care from one provider to another, including end-to-end automation of the entire referral lifecycle. In authorizations, we're unblocking barriers to care with automated creation and submission of prior auth, as well as statusing and analytics. And in scheduling, we're matching patients with the right provider and really eliminating the need for scheduling-related phone calls altogether. And finally, intake, we've modernized every step in the registration and intake process, from appointment reminders and check-in to insurance verification and payment collection. The middle section of the slide highlights our approach to implementing these solutions. We start by defining the existing manual workflows and measuring baselines with our partners. And then we standardize the workflows for maximum efficiency and impact, and this is based on patient preferences and behaviors, as well as payer policy changes. And finally, we can move to automation and digitization by deploying and maintaining digital assistants to improve the speed and quality while still creating capacity for teams. And this is the approach that ultimately turns these manual workflows into Notable's automated flows. Moving down to the last section of the slide, these are all the capabilities we rely on to drive the success of our platform. We start with intelligence to determine when and how to perform a workflow. Personalized engagement then prompts patients, providers, and staff to take the next best action. And our seamless integration with both APIs and robotic process automation, or RPA, allows us to access all the needed fields within the EHR and also link together the disparate systems to provide true end-to-end automation. Optimization and customization for your unique needs is achieved through self-serve configuration in our no-code environment. And finally, root cause analytics enable continuous improvement, as well as visibility into results and areas that need optimization. At the end of the day, outcomes are most important. This approach I've outlined and any technology must ultimately address the problems our health systems are facing. At Notable, we're really obsessed with outcomes and constantly trying to improve upon what we deliver. What we're seeing on this slide are just a few of our partners and the results that we've achieved with them so far. We're ensuring that they can readily attract and retain patients, enable their limited staff to have the greatest impact possible, fund their mission through appropriate collection of patient revenue, and manage their enterprises in a cost-effective way. Thank you so much for your engagement and any question that you posted throughout the webinar. I'll hand the mic to Katie, and then we'll move into our Q&A session.
Thank you, Dave and Chris, for that fantastic presentation. We're now going to begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box you see on your dashboard. We will try to get through as many questions as we have time for. Lucia, I'll pass it over to you.
Thank you so much, and thank you all for submitting your questions today. The first question we have is for Dave. It's really amazing to see the pride that your care coordinators take in their role. What was the approach that you took to change management when Notables technology was first introduced?
Yeah, and there certainly was a strategy there. You know, as simple as it may sound to, you know, say, hey, let's just take away some of that work that, you know, the bot can do. I think there's an innate scarcity mentality, right? Where if pieces of my job are being taken away, you know, is my job going away, or what does that look like? So we did have to spend a fair amount of time trying to reemphasize and articulate that no, definitely not going away, and we need more of you than we currently have, and what we're doing by automating this work is giving you more time to talk to patients and be on the phone and be meeting their needs that way, and less time just looking at a computer. I think it also took some time for people to trust the bot, the Notable bot, right? So I think there were folks who, look, I do this work, I do it really well, and they do, and they were right. Can the bot really do what I was doing? And so we did small tests of change, right, to make sure that it worked and that things were pulling in the right way, and then had to make tweaks, right, where our care coordinator team could articulate, you know, what the bot was not doing quite correctly and be able to make the adjustments, of which Notable quickly made those. And I think that overall kind of change and getting some of our early adopters and opinion leaders on board to be able to use the tool and be able to show that it was doing what it should and what they were doing with their time instead of doing that pre-visit planning, chart scrubbing, I think was pretty instrumental in moving forward with the change.
Thanks, Dave. The next question that we have is, we're early on in our value-based care journey and struggling with collecting and reporting patient data. What advice would you give us as we transition from a manual to a technology-based approach?
Do you want to take that one, Chris, or do you want me to jump in on that one?
All right, struggling with my mute button again. Do you want to take a first swing and then I can follow
Sure.
you?
Yeah, sure. I think there certainly has to be some broader communication, you know, both within the practices and outside of the practices, that, you know, we're going to start communicating with patients in this way. I think, at least in our market, in our instance, text messaging as a way to receive a notification has gone really well, especially as it's tied to an appointment that a patient is anticipating. And so we've seen the adoption of, you know, people using that information to be really well. On the flip side, as patients fill out that information, our teams are reviewing it, making sure that it's correct, and honestly, it's really simply just more efficient than the paper form process, you know, that we would use previously when a patient would come in and we hand them a clipboard and a pen and say, here, please fill this out. They're doing that 2 days in advance. They're paying their copay in advance. They're really just showing up at the front desk to say hello and that they're here, and then all that information is already processed on the back end and reviewed. So we've seen really great support and engagement from both our patients and providers and other caregivers in using both the forms tools and, you know, the output from the Notable bots on chart scrubbing. I think as you get going, simply understanding what's in place now and being able to articulate how this will be different, or in many cases, how it will be the same, but simply more efficient than what was done previously.
Yeah, just kind of following on that, there's a struggle to make process changes within healthcare, and we're starting to realize that patients really want this change. And if you take that narrow focus approach and deploy really quickly, it allows you to make that transition a lot faster. And although there's bumps in the road, as long as you're continuing to iterate on it, those kind of smooth out, and your internal team eventually falls in love with the process and knowing that it just gets easier and easier and patients get happier and happier.
Great, thank you so much. The next question we have is, Dave, are there automated dashboards that allow your team to understand and assess the improvement, for example, for HEDIS measures?
Yeah, there definitely are. Notable helps us in keeping track of the work, that's being done, how many care gaps are closed, or how many charts were scrubbed. But on the back end, that's actually one of the core competencies of Castel, is to get in and understand performance on HEDIS and those HEDIS measures and those care gaps, and make sure that things are being collected appropriately and get reported appropriately. So we are able to see and track and watch that progress move via those reports and tools that we've created.
Great, thank you so much, Dave. The next question we have for you is, how are you thinking about modifying or meeting patients where they are with this technology for those individuals that may not be adept at technology, or for areas that might be lacking in technology, such as rural areas?
I think we've been pleasantly surprised at the number of people who are able to do this. I think I'm always surprised at the number of people who, maybe in spite of their difficult living circumstances, still have a smartphone and can receive text messages and can fill things out from that perspective. So we've seen adoption in our rural areas be very good, and adoption with our senior populations as well. There certainly are going to be folks who don't want the tech or don't want to do it that way. And honestly, we simply use the old kind of paper form process for those individuals as they do that work. But in reality, it's very much the minority, at least what we've seen. And I think that surprised us a little bit. So many folks would be willing to use it, but they like it and we like it, and that's been great.
Yeah, following up on that, Notable recently published another case study with another partner, Reed Health, where we went live with a geriatric clinic and had a 56% digital conversion rate with all patients above the age of 65. So this kind of data and support has really shown how anyone can kind of use this type of software, and even the elderly population enjoy doing so.
Awesome, thank you so much. And the next question is a bit of a follow-up to that one. How do you meet those individuals who speak a language other than English where they are?
So in terms of patients who are non-English speaking, for Notable, we're able to convert these forms or workflows that are patient-facing into almost any language. We have a handful that are out of the box, but then we'll work with our partners to understand which languages are the highest priority, and then work with translators to get those translated into the appropriate languages for the patients.
Awesome, thank you so much. The next question we have is, how did Castel manage providers moving to the platform, and how did you help patients adjust to this new way to engage?
Certainly a fairly robust communication plan, at least internally amongst our primary care service line, to help providers know where information was going to be populated in their workflow. And that was done with a lot of collaboration with providers as well, to make sure that that was really where they wanted it, and Notable was able to customize that even in the Cerner environment, and put it where they wanted it and could use it. I think on the patient side, to be honest, we didn't do a whole lot. We simply started sending text messages associated with their appointments, and looked for the uptick, and people just used it, and started participating with the technology. I'm sure we had a few individuals who called in and wanted to verify that this was not spam and that it was really information, and it was Intermountain sending it, of which our teams, of course, had to be trained and able to answer those questions and confirm that, yes, that's coming from us, please fill it out. But we don't do very much of that. Patients have just been really good to adopt it.
Yeah, and I think this goes to kind of highlight that using these channels that patients are already used to and actively using for their own reasons, they're just naturally going to answer that text and follow that link and go through that workflow much easier than having to download an app. And then on the provider side, the nice thing about Notable's integration is that we're not using other applications, so the provider's workflow doesn't get derailed, and they don't need to open a new app to see how the patient answered their PHQ-29, and it just lives directly in the Cerner atmosphere.
Great, thank you so much. Perfect segue into our next question. Can you talk about how Notable integrated with the Cerner platform?
I might sound a little biased answering that question, Dave. Do you want to take that one?
Yeah, I'll answer it, I guess, from our perspective, and then you certainly can jump in. But we didn't really have any major challenges there. Certainly some coordination with our care transformation information systems teams to make sure that it's being done correctly. I think what I thought was particularly innovative, especially with chart scrubbing, is that the bots do this work at night when utilization of the EHR is low, in order not to bog down the speed of Cerner in our instance, and yet still accomplish the work when it needs to be done. So, from the operator's perspective, my perspective, I don't have too many snags that we ran into there, and it actually moved very quickly. We have a great IT team and care transformation team that helped with that, but overall it went great.
Awesome, thanks, Dave. The next question we have for you is, can you talk us through the process of closing the loop on meeting needs related to the social determinants of health as identified by your team?
Yeah, so
how
Notable,
how Castel does it, or how Notable does it?
Both.
That'd be great. Fine.
So from the Notable perspective, our goal is to mimic the existing manual workflow as much as we can. So with the SDOH issues we discover, we're documenting it just the way the care coordinators are, And then it's a process of handing off that information to the care coordinator, or maybe it's the physician, to then act on the issues that are identified there.
Yeah, I think that's right. I mean, Castel has, about 200 care coordinators and about 100 care managers that are doing, some of this work in population health. And so for us, it was really, having a solid process map, understanding where swapping out this technology for an existing paper or manual process exists, and then kind of bolting that on, being able to do that. So, as social determinants information is gathered, for example, in the, care management assessment or in those intake forms, those are really being routed right into, the EMR and in their workflow, and then they can then use and deploy the tools that they've been trained to use on how to act upon what the patient has submitted via the technology.
Great, thank you so much. The next question we have for you, Dave, is, can you tell us more about how your team's priorities have changed since implementing Notable?
Yes, I would say primarily what has happened is our teams have spent more time on the phone. Our workforce is actually completely remote. They do have the ability to pop into a clinic and work through some of the relationships and some of those patients who, remote doesn't work for them. But in large part, we've seen our ability to be able to onboard more caregivers, make more outbound phone calls, and get that work done, improve since we implemented Notable, and that's the work that we both want the teams doing, and I think that they want to do as well, and as they've voiced their appreciation for being able to do that.
Great, thank you so much. What are you most excited to accomplish over the next 6 months?
Oh, we have so many ideas of things that could and should be automated based on our experience with kind of these initial use cases. We'll continue to do things and enhance things, as we mentioned, in the care management space. We're also looking to automate some of our documentation and coding work. We have a team that does longitudinal record reviews, identifying conditions that may have been documented in non-coded fields, and making sure those surface to the provider in the right way. To be able to automate some of that is going to be really, really great, and we're going to try and make sure we can get all that stuff done in the next 6 months. And then I think we'll continue to try and identify other areas of our operation that are manual in nature and could be replaced with a technology that both improves the morale of the people doing it, but creates a return on investment for Castel as well.
Awesome. Thank you so much, Dave. And thank you for sharing how Castel is proactively identifying and closing these important care gaps with streamlined population health workflows. It's been such a joy to partner with you and your team. I'll pass it back over to Beckers to close us out today.
Thanks, Lucia. That's all the time we have for today. I wanted to thank Dave and Chris for their excellent presentation and Notable Health for sponsoring today's webinar. And thank you so much to each of you for joining our conversation today with Castel and Notable. We hope you'll join us for the next webinar in Notable's Beyond the Portal Digital Front Door series on April 21st at 12 Central Time, which will highlight how healthcare organizations can unlock growth goals by accelerating acquisition and retention with patient self-scheduling. Enjoy the rest of your day, and we look forward to having you join us for future webinars.